We are providing care to about 2,500 people who are in about 700 different families. Community Nurse's mission is to provide physical, behavioral, and oral health care services in an integrated fashion to the low-income population of 14 West suburban communities.
Georgina has been coming to Community Nurse for about 12 years. She has had 8 or 9 foster children. The 2 foster children that she has now are currently patients of Community Nurse. You know, when Jeremiah first came to our clinic, he was crawling into the clinic. We sent him to a specialist and they did surgery, and within months he was walking. Sometimes we call Georgina like God's angel, because every child that she brings in within like a year, you see such a big development change in the child.
You know, but what I say to the agency is not by myself, it's with the community nurse too. You know, with everybody here in it, work with the children with me.
Community Nurse offers help in many ways. Not only do we provide primary health care, but we also provide services beyond what happens in the office setting. We provide behavioral health, mental health services. We provide dental services. So it's really very comprehensive in that we're providing oral health, mental health, and primary care in all one setting. Makes it very holistic.
In high school, there was just a lot of problems going on at home, outside of school. And then I came here and I was going through some things, and they just like helped me mentally and physically. And they gave me some like reassurance, you know, that everything was gonna be okay. They actually cared. You know, it's hard to find healthcare providers that care. They'll save you physically if you're having some physical problems. They'll help you mentally if you're having, you know, you're confused, you don't know where to turn, you know, you just don't know where to go in life. They won't just kick you to the curb or just throw you some pills. They'll actually try to get to the core of the problem.
This Community Nurse has been here for 90 years. I think it's endured because there has been an unbelievable can-do attitude, going back to even the early 1920s when a group of women in the community and civic organizations saw the need to bring actually a position that they called the community nurse to the western suburbs, mostly to focus on well child care. All those associations got together and started raising money, and we hired our first community nurse, and her first day of work was January 24th, 1921, and she stayed in that position for 23 years.
The support that we get from the community is incredible. We could not do what we do every single day without that. Not only do we receive financial support from various donors, but we also receive the hands-on working volunteer who helps in the shops, who also helps with the Secret Santa program, and then again our clinical volunteers who help provide the actual hands-on patient care. We always say that in order to be a productive community, you have to have a good, healthy community. If we weren't not in the area to provide the care that we do, there would be many more emergency room visits. There would be many people who would forego any kind of health care until they were in crisis. So I think that if we weren't around, there would be probably over 2,500 people that would be looking for other ways to access health care, and I really firmly believe that many of them would just not receive it.
You know, I don't want to think about, you know, the community nurse going to leave one day. And we make a lot of change. I make a lot of change. These kids in community nurse make a lot of change in us, you know, in the family. If they want to help, they can change the world. They help a lot. Helping a lot to many people.
What if you hadn't have had community nurse? Where do you think you'd be right now?
I don't even know if I'll be alive.
They really did say.
Yeah, they did.